We're now going to look at amputations. Now in this example here, we've got amputation on the lower leg. Now if you were out on a boat, for example, this is a very unlikely way to get amputation like this, but it's one of the worst things that can happen. So it's always best to train what's worse. More likely this could be an amputated finger, or it gets caught around ropes and cut off, or maybe even a hand. But this sort of injury can happen if someone falls off the back of a boat and then the boat stops. They keep moving under, the prop then gets them and literally chops their leg off. So although we're saying it's not that common, this injury can happen. So with something like this, the first thing we need to deal with is bleeding. We need to look at the injury, see how much it's bleeding. We may need to put a tourniquet on. Because this is very close to the knee, we would put that just above the knee, because we don't want to put a tourniquet over the knee. And we're covering tourniquets in other videos, so you understand more about those. And then with the stump area there, what we need to do is try and dress that the best we can. Now, once the tourniquet is on and the bleeding has stopped, remembering you can put a second tourniquet on if you need to, then lay over one of the new generation haemostats like WoundClot, because that's going to stop the bleeding and also help the healing cascade. So we're going to start to make some healing around that area. We also need to cover it to prevent infection. So we'd use a trauma dressing for that. So you just open up the packet of the trauma dressing. So once you've got the dressing out, we're going to need to open it up. So with these dressings, if you open up the packet, you can look through and you can see a little nick in the top, and that's where it's easiest to tear it. Remembering when you're doing this for real, you would have your gloves on, but for training here, we're just doing this just without gloves. So this has got a pad on there. This is one size of trauma dressing that's common in lots of bleed kits. There is the larger sizes as well. So if you go for a larger size bleed kit, you'll have the one that's much, much wider. But for this, we can literally cover over the stump itself, and then we need to pop the dressing round to try and keep that dressing in place. Now the thing with trauma dressings is they've got a lot of stretch in them, so we can pull that round nice and tight. Probably, if in the real case, you may need another dressing over the side there, but just literally cover it over the stump, because we're trying to stop any infection getting in and also applying enough pressure on the wound to try and stop any bleeding that's still there. So the hemostatic bandage underneath the gauze will be in place. So we literally pull that round, and these have got Velcro on, so literally with this type of dressing you just pull it round back onto itself and the Velcro will hold it in place. It's an idea is to try and get something on it to stop the bleed, to keep that controlled and keep that clean. So if you were out and you've got a long way to travel, we'd not only stop the bleed with the tourniquet, we've kept the injury site clean and covered, and also hopefully with the likes of the hemostat actually stop the bleeding and starting the healing process. So then we can treat the patient for shock. Now finally, with an amputation case like this, if you have got a amputated part, then it's a good idea to keep that. Now in the example I gave with the legs under a boat and the prop cutting off, you may not have anything, there may be just nothing left. It may be that the limb is still partly attached, in which case you need to put the tourniquet on, stop the bleeding, and then do your best to cover up the wound and hold it in place once the tourniquet is on and once the bleeding has stopped, because once that tourniquet is on, it's going to go numb beyond that site, so it's going to be much easier. But make sure you don't damage any good tissue, because we're hoping that a surgeon can then sew the limb back on and reattach it. If it's something like a finger and the finger has come completely off, then we can safeguard that finger by wrapping it in cling film or plastic to keep it nice and clean. And then we can wrap it again in something like a tea towel or a cloth or a t-shirt, something like that. And then keep that in ice water so that we can hopefully keep it in a state where it can be sewn on by the surgeon later on. But remember, don't put ice directly against the removed item like the finger, or directly onto the injury site for the amputation.